Hello and welcome to my final project on the drug Lorazepam, but you can also think of it as your favorite chill pill. Now, Lorazepam, which is also known as the brand name Ativan, is a commonly prescribed synthetic psychoactive medicine in the benzodiazepine drug class with an extremely high potency, with drug manufacturing company Bausch Health citing absolute bioavailability as high as 90% in the immediate release tablet and solutions in 2023. It is also considered a Schedule IV controlled substance, which means that it is approved for medicinal use with a valid prescription, but it has a limited risk of physical or psychological dependence. Recently, there has been some push to have the benzodiazepine drug class reclassified as a higher schedule, and we'll get into a little bit of that later. Lorazepam was not the first of its kind. Here's a short view of the timeline of relevant drug development, starting with the high-risk drug class called barbiturates. These are strong sedatives with even stronger side effects of a high risk of addiction and overdose. This in an effort to discover safer alternatives to barbiturates for a similar sedative effect, benzodiazepines were discovered and were quickly labeled at a low risk of dependence, likely due to the comparison of barbiturates and the lack of observation of long-term use of benzodiazepines at the time. Nowadays, barbiturates are only ever commonly used in surgical anesthesia contexts. In the outpatient world, the benzodiazepine class essentially replaced barbiturate use for routine treatments of anxiety, seizures, insomnia, and things like that. So, benzodiazepines, like lorazepam in general, act in similar mechanism of action. Benzodiazepines are allosteric modulators of the GABA A receptor that is primarily found on the central nervous system. These GABA A receptors exist on the neural membrane and have 5 subunits with a chloride ion channel down the middle. Going back to what we learned in class about allosteric modulators, we remember that an allosteric modulator are ligands that bind to a site on a protein that changes the affinity for a different substrate of that protein at a separate binding site. Benzodiazepines act by binding to the GABA receptor between the alpha and gamma subunits, shown in the arrow here. This changes the shape of the protein, which increases the affinity of GABA to the GABA A receptors located here between the beta and alpha subunits. Again, the role of the benzodiazepine increases the binding of GABA to GABA A receptors. Next, when the GABA binds to the GABA binding site, the ion channel opens to allow chloride ions into the cell. Now, what is more important than just understanding the mechanism is truly understanding the effect of the mechanism. The influx of chloride will cause a neuronal hyperpolarization, which is inhibitory by reducing the neural excitability or making the membrane potential more negative. It is seen in the solid line on the graph shown. Hyperpolarization will make it more difficult for a neuron to reach the action potential threshold. It would need a much stronger stimulus than usual to create an action potential. Now, the type of receptor affected, the GABA A subtype, are the most abundant GABA receptors, which is the primary inhibition system among the central nervous system. Because these receptors are so widespread among the body system, it explains the strong sedative effects, including the reduction in anxiety or any heightened emotions, reducing seizures, reducing insomnia, and causing anterograde amnesia, which is where there is an impairment in the formation of new memories. I added an animation here depicting a woman taking pills outside on a cloudy day. After swallowing pills, she smiles, the clouds clear, and a rainbow appears. This animation is a hyperbole, but it does depict the intended effect of unclouding your nervous system, where inhibiting the overactivation of the central nervous system by taking benzodiazepines. Now, here's where I want to distinguish lorazepam from other common benzodiazepines. Lorazepam is a fast-acting drug with a medium duration, where the drug half-life is about 12 hours on average. In cases of overstimulation of the central nervous system causing an emergency, such as panic attacks or seizures, the 3 fast-acting benzodiazepines, alprazolam, lorazepam, and diazepam, stand out as the most appropriate therapeutic choices. However, this comes with a downside. As we know, the speed of action of the drug contributes to the addictive potential of the drug, making lorazepam one of the higher addiction potential of the benzodiazepine class. Additionally, lorazepam is preferred over the rest of the drugs shown on the screen here for controlling seizures and recurrent panic attacks, since it acts immediately and stays effective for a longer time than others, controlling the body from overactivating to another moment of high anxiety or seizure. To clarify, diazepam is a long-duration benzodiazepine, but since diazepam has a higher depot binding into fat than lorazepam, with no evidence of depot binding, it has a slightly different effect which prefers lorazepam for the cases of overactivation. Now let's talk about the important pharmacokinetic factors of lorazepam. First, the most common administration for this drug is the oral route of administration. This is also the only route of administration that is available through outpatient settings, either in pill or sometimes liquid form. The oral route of administration creates the slowest onset of drug effect of all the administration routes, marking the oral route as the slowest addiction potential. Another common route is intravenous, but this is something you would only see in a hospital setting where a drug onset needs to be quick, like in an emergency or seizures and high agitation. Lorazepam is unlike other drugs of its class for its metabolism. It avoids interaction with the CYP enzyme system, making it less susceptible to enzyme induction or inhibition. Additionally, this makes lorazepam a safer option for patients with liver impairment and lowers the drug interactions. Instead, it is metabolized by a UGT enzyme class. Now, even when used as directed, lorazepam, like other benzodiazepines, have a strong potential to cause physical dependence. This dependence can occur within weeks of regular use due to the changes in the brain's GABAergic system, leading to an overcompensation of higher activation onto the GABA system. Thus, higher doses of lorazepam are needed to create the same drug effect. Additionally, the withdrawal of lorazepam can include symptoms of increased irritability, anxiety, or seizures that are worse than baseline. This reinforces the behavior of taking lorazepam regularly, causing the vicious cycle with worsening withdrawal effects long term. As covered throughout this presentation, the fast and intense onset of drug effect caused by lorazepam and other benzodiazepines creates a risk of high potential for addiction. The oral route of administration is the only outpatient form of lorazepam commercially available, but even though it decreases the addiction potential from a route like IV, it does not completely lower the risk for addiction. I included a graph showing the rise of drug overdose deaths in the U.S. by benzodiazepines since the start of the 21st century. It is no doubt that this rise in deaths calls for a consideration of increasing the regulations of benzodiazepines on a federal level, since there is a clear potential for abuse. Thank you for listening to my project on benzodiazepine lorazepam. I hope you have learned more about the drug and some of its distinguishing features as a psychoactive drug. Thank you.